Hello everyone. Today I'd like to invite you to imagine a future where healthcare is no longer centered around hospitals but around healthy communities. For over a century we've become exceptionally good at treating disease, yet far less successful at preventing it. Chronic illnesses such as obesity, diabetes, cardiovascular disease and dementia continue to rise despite ever-increasing healthcare expenditure. I believe that now we have an opportunity to fundamentally rethink public health by combining lifestyle medicine, digital technologies and community engagement into neighbourhood wellbeing hubs that empower people to take greater control over their own health. We're living through one of the greatest public health challenges in history. Populations are aging, healthcare costs continue to increase, and demand is growing faster than healthcare systems can respond. The traditional model is reactive. We wait until people become ill before intervening instead of asking, how do we treat disease? Perhaps we should ask first, how do we help people stay healthy? That simple change of mindset has profound implications. I'd like to share this video with you as an illustration of how disruptive digital technologies such as AI and advanced wearable technologies combined with neighbourhood wellbeing centres can extend longevity, increase our health span and bring immortality within our grasp.
We track our lives by the clock, counting the years since birth. But that chronological number hides the active cellular reality ticking away inside. Modern medicine operates almost entirely in the wake of this internal decay. It waits for the heart to tear or the cells to fail before stepping in to attempt to repair. This chart shows the immense volume of lifestyle-driven conditions compared to unpreventable genetic ones. Roughly 70% of cardiovascular disease and 40% of dementia cases are entirely avoidable. Treating those conditions only after they surface guarantees biological failure. Escaping this cycle requires treating the body not as a clock that inevitably runs out, but as a system we can proactively engineer. We can actively reverse metabolic decline by tracking personal biomarkers and using continuous feedback loops to adjust our daily inputs. A standard 5-minute doctor's visit advising a patient to simply eat less and move more rarely triggers lasting behavioural change. Look at this graphic detailing nutrigenetics. Personalised dietary interventions lower biological age by targeting exact inflammation mechanisms, but this varies. Genes like COMT and MAO dictate how your body processes supplements, meaning an anti-inflammatory compound for one person could trigger anxiety in another. You can decode your DNA and refine your metabolic signaling flawlessly, but if you walk out your front door into a toxic, highly processed environment, those internal optimizations will eventually collapse. Individual willpower cannot out-medicate a sick environment. When physical spaces prioritize sedentary routines and ultra-processed diets, they dictate biological fate. To fix this, urban planners are adopting a recognized blueprint known as ISO 25553, or Neighbourhoods of the Future. It physically engineers preventative health directly into the layout of a city. The anchor of this redesign is the decentralised community wellness hub. It takes proactive care out of the acute hospital ward and embeds it straight into the places where we live and work. Notice how the concrete roads in this architectural model dissolve, replacing traditional streetscapes with integrated green corridors and exercise zones, makes cardiovascular movement the default option. By collocating healthy food cafes alongside those spaces, the urban layout eliminates food deserts. When movement and nutrition are integrated into the city grid, lifestyle medicine stops being an exhausting daily chore. It becomes an effortless, immersive feature of the environments. Beyond physical fitness, urban design tackles the invisible epidemic of social isolation. Chronic loneliness physically alters the brain and is a primary measurable driver of cognitive decline. By stacking services for different age groups in one shared physical space, the built environment forces daily organic interaction across entirely distinct generations. The benefits flow in both directions. Elderly residents gain vital neurological stimulation and a renewed sense of purpose, while young families receive active community support during a child's critical developmental years. This structured community-driven connection acts as a preventative medical intervention as powerful as any prescription drug. A preventative neighbourhood functions as the primary health intervention, surrounding the citizen with a seamless ecosystem of care. Yet, with perfectly optimised biology and meticulously designed cities, the physical shell has an absolute limit. The biological body will eventually reach its breaking point. The next frontier bypasses biology entirely. We are using massive data sets and artificial intelligence to preserve the mind, moving toward a form of digital immortality. Throughout your life, you are constantly generating what researchers call a mind file. This is the massive, chaotic digital footprint made up of your emails, photos, voice notes, and social media posts. This flowchart outlines Joshua Hurtado's immortalization process. AI models scrape raw data, organize it, and learn conversational patterns. In the final phase, embodiment, the AI receives a voice or 3D avatar. This simulates a digital personality, letting the living interact with the deceased. We are already seeing this applied through 360-degree virtual reality living memorials. Descendants can step inside an immersive space to interact with ancestral memories, hearing stories told with the distinct tone and cadence captured in those original digital records. Our digital footprints now allow a personality to keep learning, reacting, and existing on a server long after the heart stops beating. We have severed the historic tie between human presence and biological lifespan. By optimizing internal biology, architecting the physical landscape, and preserving the digital mind, we are shifting human mortality from a fixed biological limit toward a variable engineering challenge.
The encouraging news is that many of today's chronic diseases are largely preventable. Research consistently shows that healthier lifestyles can dramatically reduce the risk of heart disease, type 2 diabetes, many cancers, and even dementia. The challenge isn't simply providing information. Most people already know they should eat better, exercise more, and sleep well. The challenge is helping people make sustainable behavioural changes within their everyday lives. Imagine every neighbourhood having a well-being hub rather than simply another medical centre, a place where healthcare professionals work alongside lifestyle medicine practitioners, exercise specialists, nutrition experts, community organisations and digital health coaches. These hubs become centres for prevention rather than treatment. They help individuals before illness develops rather than after it becomes expensive and difficult to manage. Health has never been solely about medicine. It's about belonging, purpose, social connection, education, employment, housing. Our communities have enormous potential to become health-producing environments. Neighbourhood wellbeing hubs can reconnect healthcare within community life, reducing loneliness while encouraging healthier behaviours through local support networks. Technology often receives criticism, and sometimes rightly so, but Technology itself isn't the problem. Used wisely, artificial intelligence, wearable sensors, mobile health applications, and personalized coaching can become powerful tools for prevention. The key principle is simple. Technology should enhance human relationships, not replace them. The future of healthcare depends on moving people from passive patients to active participants. Instead of relying solely on professionals to monitor our health once a year, technology allows us to understand our health every day. Small improvements repeated consistently produce remarkable long-term results. Our role becomes helping people build healthy habits rather than simply prescribing treatments. This isn't about replacing doctors or hospitals. It's about creating an integrated ecosystem, primary care, community organizations, lifestyle medicine, digital technologies, artificial intelligence, local authorities, education, employers. Each plays an important role in supporting healthier communities. Lifestyle medicine provides the scientific foundation for this vision. Rather than focusing primarily on disease management, lifestyle medicine addresses the root causes of chronic illness. It combines evidence-based interventions that help people improve both the length and quality of their lives. This isn't alternative medicine, it is evidence-based medicine centered around prevention and long-term well-being. The British Society of Lifestyle Medicine identifies 6 core pillars: healthy nutrition, physical activity, restorative sleep, mental well-being, healthy relationships, and avoidable harmful substances like tobacco or alcohol. And I would add a 7th. Actually, from my own experience, would also add hydration as being a very important factor as you get older. Each of these pillars reinforces the others. Technology can support every one of these areas through personalized feedback, behavior tracking, coaching, and early intervention. The goal isn't perfection. It's continuous improvement through small, sustainable lifestyle changes. And digital technologies have a role to play in all of these areas. I often describe this as a digital health sat-nav. Just as satellite navigation guides us towards a destination while constantly recalculating our route, digital health technologies can help us guide towards healthier lives. They provide feedback, they measure progress, they adapt recommendations, and when we drift off course, they gently help us get back on track. And that's a far more empowering approach than waiting until illness appears. Many of these tools already exist: smartwatches, fitness trackers, blood pressure monitors, continuous glucose monitoring, nutrition apps, sleep monitoring, mental well-being applications, artificial intelligent health coaches. The exciting opportunity isn't creating new technologies, it's integrating and improving the ones we already have into neighbourhood well-being programs where professional support and community engagement maximise their value. Now, I personally use wearable technologies and gamification for around 13 years. The results have transformed my own health and well-being. Around the world, similar programs consistently demonstrate measurable improvements in physical health, mental well-being, motivation, and long-term behavior change. When technology, lifestyle medicine, and community support work together, people become healthier and healthcare systems become more sustainable. So the question is no longer whether this transformation is possible. The technology exists, the evidence exists, The need is undeniable. The challenge is bringing these elements together into practical neighbourhood models that every community can access. Healthcare must become proactive rather than reactive. Prevention must become everyone's responsibility. I'd like to leave you with one thought. The future of public health will not be built simply by treating more illness. It will be built by creating healthier people, healthier communities, and healthier environments. Neighbourhood Wellbeing Hubs represent an opportunity to combine the best of lifestyle medicine, digital innovation, and community engagement into a new model of proactive healthcare. If we succeed, we'll not only extend life expectancy, we'll extend healthy life expectancy, reduce pressure on healthcare systems, and enable more people to live longer, happier, and more fulfilling lives. Thank you.